everyone, my name is Kitti Urbán, and today I'm honored to present my research exploring sport-specific interactions between oral health and elite sport. This topic helps to understand how high-intensity training shapes both salivary biology and oral health outcomes, and why these interactions are important for prevention, performance, and athlete well-being. So a little bit about my team. I'm a prosthodontist, my supervisor is Mercedes, my SMS is Darius, the statistician is Tamás Koy. Our vision is developing individualized oral health care strategies for elite athletes. And to reach it, the mission is to investigate how high-intensity training alters salivary composition. On this slide, you can see the two main pillars of my PhD work. The first one focuses on how high-intensity training shapes the salivary composition in elite athletes, while the second looks more broadly. It's about how the different level of sport participation affect the oral health indices. With these two topics, it gives us both a mechanistic and a population-level understanding of sport-related oral health. So let's start with the first, investigating the effects of high-intensity training on salivary composition in elite athletes, a systematic review and a meta-analysis. Before we begin, I want you to think back to a moment when you have to push yourself physically, maybe in a PE class. You know, the kind where the teacher genuinely seemed to enjoy watching us suffer a little. What was the very first memory you remember? Besides that your PE teacher is a sadist. Wasn't it that your mouth became so dry that even swallowing felt impossible? What if the simple feeling of a dry mouth is more than just thirst? So why saliva? Saliva is not just a water, it has multifunctional role. It can lubricate, it helps in remineralization, it helps in the antimicrobial defense, but also, on top of all that, it's an ideal biomarker source because we can collect it non-invasively and repeatedly. Unfortunately, most studies focuses on single salivary markers, for example, on cortisol or the IgA level, but in elite sport, we need a broader picture. Elite sport is associated with extremely high physical and physiological demands. While most studies have focused on recovery and performance, athletes' oral health has been often overlooked. However, there are some reports, for example, London 2020 Olympic Games, which show that we have to care about athletes' oral health. Athletes can also develop a condition so-called runner's mouth, dryness, erosion, caries risk, and inflammation, which not just affect their oral health, but also their performance and recovery. So the aim is to characterize the coupled dynamics among salivary composition, oral health, training load, and performance within athletes. And to reach it, our clinical question, what is the effect of high-intensity training on salivary composition? The population is elite athletes. The exposure is after training. We compare the before training, and the outcome is the salivary composition. We hypothesize that high-intensity training disrupts microbial balance and salivary composition, increasing stress markers by reducing immunity, flow, and pH. And if it's true, it's important because of the dental part is the early oral disease prevention, and because of the performance, and for the coaches, is the overtraining risk detection. Our domain, the first domain, is about the athletes and the high-intensity training, while the second domain targets saliva. Here you can see the three key articles. The first one is about handball players, while the second and third are about football players. And you can see the same patterns as the cortisol level increased, and the amylase level also, while the IgA level decreased. On this slide, where we are standing at the moment, after the full text selection, we have 274 articles. I finished with the data extraction, and now with my team, we are doing the figures and the statistical part. We discussed that we have so many biomarkers, so we will have 5 important ones. So we will do the statistical part for the cortisol, the testosterone, cortisol to testosterone ratio, the alpha amylase level, and for the IgA level. First, we start with the cortisol. It's just for a visualization plot. So we have 151 studies just about the cortisol level. Here I just wanted to show, or we wanted to show, how complex this project is. And it can help us find out how we can go on. So we will do subgroups according for this sport type. It's like the combat sport, team sport. We will also have endurance and power and strength, and also for the technical and precision. We will also have factors like the sport, the exercise duration, also the ages, so like children, adolescents, young adults, or the adults, and also when we measure the post values, so maybe immediately after the exposure, so the exercise, or 15 or 30 minutes after the exercise. It's also it could be important if it's an official training or an official match or a training. So we discussed that we will have a multivariate analysis here. So for the future, we will move on this direction. So moving to the next project, we wanted to broaden the lens from the elite athletes to more broadly, wider. So the professionals, recreational athletes, and non-athletes. So the title is Investigating the Effects of Competitive and Recreational Sport Participation on Oral Health Indices, also a systematic review and a meta-analysis. We often hear the statement that sport equals health, as a physical activity automatically guarantees well-being. But this relationship is far more nuanced. The real question is, at what level of sport participation does this hold true, and when might this balance begin to shift? So first, look at the sport part. What does sport mean for an individual who trains twice a week versus who trains twice a day? It's not the same. So following this logic, we can make two subgroups. The recreational athletes, which is a bigger group, 35 to 42% of the population according to WHO. Their physical activity are regular, moderate physical activities, and their main goal is health, fitness, or leisure. While elite athletes has a systematic high-intensity training programs. They compete at national or international levels, and their main goal is to win. Oral health is part of the well-being, but have this huge spectrum, so from the occasional gym session to the Olympic level training can affect the oral health. That's where an interesting gap in the literature appears. So here the aim is to map existing evidence, identify gaps, and characterize the coupled dynamics between physical activity level and oral diseases. Let me show a short example. Here, Dutch elite athletes who competed at the Rio Olympic Games at 2016, and 27% of them said that it affected their quality of life, the oral health, and 10% said that the oral health affect their trainings. So we have to care about the oral health. Here, the clinical question, does the level of sport participation influence oral health indices? The population are the individuals with varying levels of physical activity. The interventionals are professional and recreational athletes, and we can compare it with no training. And the outcome is the oral health indices. So here the hypothesis is competitive sport is linked to poorer oral health and periodontal status, where recreational athletes perform better. And why is it important? Because we can encourage development of sport-specific oral health interventions. Here, the first domain targets any type of sport participation, while the second domain is about the oral health indices. Here you can see the first 3 key articles, which is about comparing the professionals with the sedentary lifestyle, while the other 3 articles are about comparing the regular physical activity with individuals who aren't doing any kind of sport. And here, last, you can see the future aims and the plans. And if I have to sum up, I would say that oral health is not just a dental issue, it's a performance factor. Or, as Roger Federer said, the more I train, the more I realize that health is the foundation of performance. Thank you for your attention.
My question would be that you mentioned the subgroups, and that there are multiple different types of sports that you will include in different subgroups. My question would be, what kind of sports are these? And because, for example, a chess player, I expect that they won't have the same cortisol level, for example, in their saliva as a football player. So what kind of sports do you divide into what groups?
Thank you for your question, and it's really, really important. That's why I mentioned for the first category is the sport type, because it's the most important, I think. So I think the team sport is kind of obvious. So most of the articles are about football and rugby players. We also have like hockey and Austrian rugby as well, interestingly. For endurance, it's about athletes, runners, and also cyclists and swimmers. For the power and strength, it's about the weightlifters, or there are articles about sport climbers as well. And we also discussed that we will put the sprinters here as athletes. And I mentioned also the combat. It's like taekwondo, judo, wrestlers. So this kind of sport. And also for the technical precision, it's what you mentioned. There is the curling, because we have articles about the curling players as well, or the archery, or the golf. And we also have other or mixed categories. Sometimes they measure. It's just some of them, but we also did it.
When are these biomarkers measured? So just after they did the sport, or how based on the time? When are they measured?
It's really important. The timing is really important, as we find out. So we categorized about after, if they did the interventions, the training or the match, we can measure it immediately. So this is the 0 value. After we categorized the 15 and the 30 minutes, and after it 40 and 60 minutes, so about 1 hour. We discussed that the end will be the 2 hours, because it's where it again became lower. And we think that the peak of this cortisol rise will be the 15-30 minutes.
So you will be able to do like a comparative analysis based on T0 to after 2 hours?
Yes.
Great.
Yes.
Congrats.
That's the plan. Thank you.
How did you find during the data extraction, how standardized was the biomarker collection and the sample collection? Were there many differences? Or?
Thank you. It's a really interesting question. Mainly 2 big groups we can make, the unstimulated and the stimulated saliva collection. Now we think that we won't focus on this, because there's a lot of other stuff which is more important for our project. But maybe in the future, I think I want to do a project about this, because it's also important to differentiate this.
According to your second project, is there any exclusion criteria in the patients? Because according to our, in the clinic, we can see some leisure activities that with patients that they had not so good oral hygiene, and also has some problems initially before they started the leisure activities.
Yes, thank you for the question. I think that we will orient the direction that they are all healthy individuals. I think it's important. Somehow we want to standardize these protocols. So maybe with the age, the healthy lifestyle, for example, the university or some graduation level as well, to just check this sport intervention influence.